It all started in March. Little did we know that my life and our lives would all change for the foreseeable future. Schools would close, shut down for the rest of the school year. Restaurants and businesses would begin to close. And it's all because of this dangerous virus that attacks the respiratory system called the coronavirus. It attacks the respiratory system, making it very hard for people to breathe and making it very fatal for older people and other people with underlying diseases. Dr. Panagis Galiastastos with Johns Hopkins Medical Center has said that the type of damage that the coronavirus can cause in the lungs are lung complications such as pneumonia, and in the very severe cases is acute respiratory distress syndrome, also known as ARDS, ARDS. It can also cause sepsis, or other possible complications of COVID-19 can also cause lasting harm to the lungs and other organs. So this can really mess up the respiratory system, which causes most patients to end up on a ventilator. And if they end up on a ventilator, it has been shown that it is very hard for them to come off, and it is more than likely fatal in that case. So COVID-19 was created by SARS-CoV-2, which is also known as Severe Acute Respiratory Syndrome Coronavirus 2. And this is because they are genetically similar to the SARS coronavirus, which caused the outbreak in 2002. And here you can see the deeper structural anatomy of the coronavirus. So how did this virus spread so quickly and so aggressively? Well, so here you can see the disease triangle. Here the disease is in the center of the triangle, and from there it goes to the virulent pathogen. From that point, it will then go into a favorable environment for where the virus will be able to survive. And some environmental factors that may affect the virus's survival includes things like temperature, humidity, the virus type, if it's a lipid or a non-lipid, the presence of surrounding organic material like saliva, mucus, sunlight, or antiviral chemicals. Then from there, it'll go into a susceptible host, who could be a person, an animal, whoever it may be. From that point on, that host will then give the virus to another host, and then to another, and to another, thus creating that aggressive viral spread that will then cause or helped cause this pandemic. So, according to this disease triangle, we got the virulent pathogen, it had its favorable environment, and then it went to its susceptible host, which was the bat. This started out in Wuhan, China. The only thing we know from that point forward is that someone who was infected got on a plane, infected anyone on the plane, who then continued to spread it across the entire globe. The virus then spread like wildfire. Some things we could have done, or some things that would have helped protect this aggressive spread, would be PPE. Well, what is PPE? PPE stands for Personal Protective Equipment, and PPE works as a barrier between an individual's skin, mouth, nose, or eyes and viral and bacterial infections. So this will be including gloves, masks, those visors, those big clear visors that they put on, gowns, anything that'll help protect your mouth, your nose, like basically any entryway. Because of this national emergency, PPE has been in higher demand more than ever. Because of this, we have been in a serious shortage of PPE. While the equipment is necessary for both the public and personal health, the one glaring issue is that we have such a bad shortage that it's putting anyone who comes into contact with COVID-19, patients are at risk because they don't have the materials and the PPE to help prevent this disease from spreading, and we're running out of ventilators to keep people alive. So people who have more chance of a survival will get the ventilator than the person who needs it a little bit more. And that person will then die because of this shortage. So the question may be asked, why is this crucial to stop the spread of COVID-19? Well, this is crucial to stop the spread of COVID-19 because this is what protects you from the virus getting into your system. So the coronavirus is transmitted by respiratory droplets. Droplets are then released when we breathe, talk, sneeze, cough, they carry the virus, and even people who don't feel sick can spread the virus. A lot of people are anti-symptomatic, which means they don't have any symptoms of having the virus, yet they can still give it to other people and spread it around the world. The PPE will help prevent the droplets getting into the air, allowing you to breathe, inhale, swallow the droplets, and the masks will make it less likely that we'll get the respiratory droplets on things we touch, like food, things at the grocery store. The mask can protect you from directly getting the droplets in your mouth or your nose. You can still get infected by touching your face, so if you have gloves on and a mask, you'll realize that you're touching your face, but you have gloves and a mask on, and that will potentially help protect you. Also, when having gloves, you won't have the disease on your physical hands. You got to make sure that you dispose of the gloves properly so you don't spread the disease. And yes, this does not 100% prevent the transmission. You will still need to maintain safe social distancing, but this is a big factor at helping you prevent the spread of this disease and also contracting. I chose this question because I think it is very, very, very important for people to understand and to know what PPE is and what it does to help prevent not only of us contracting the disease, but also to help prevent the spread of the disease. And it is also a very crucial material, a very crucial part in this pandemic because of the shortage, and this shortage very well can cost lives. So what exactly are we managing this shortage of PPE? And this is where human kindness comes in. Thousands of people all over the world, all over the United States, are staying home and making homemade masks for our heroes and our medical care workers. My boyfriend's grandma, as in fact, has also been a part of this. She has made over 150 homemade masks and has donated them to hospitals all over Riverside County, firefighters, and even homeless people who have no way of getting PPE. Also, companies like Tesla, Apple, and even Ford have come forward and stopped manufacturing both cars, TVs, everything that they produce, all to help build ventilators, masks, gowns, everything to help this shortage. According to Margaret Ward with Business Insider, Apple will donate millions of masks to healthcare workers. The CEO, Tim Cook, announced on Twitter that the tech company is designing and producing face shields to protect healthcare workers in the U.S. throughout this coronavirus pandemic. Apple is also increasing the number of face masks it's donating to 20 million, double the amount it had previously committed to providing. In the same Business Insider article, Tesla CEO Elon Musk announced that he and the electric car company had bought hundreds of ventilators from China and had them shipped to the U.S. He had stated China had an oversupply, so we bought 1,255 FDA-approved ResMed, Philips, and Medtronic ventilators on Friday night and air shipped them to LA. End quote. He tweeted that late on a Monday night. He then said that Wednesday that the company's factory in Buffalo, New York, will then open as soon as humanly possible to produce more ventilators there. Again, in that same Business Insider article, Ford, GE, and 3M are partnering to build ventilators and protective equipment. Ford is providing technical and production efforts to make a simplified design of GE Healthcare's existing ventilators, according to a press release given to Business Insider. The car manufacturer is also providing engineers and faculties to help produce the production of the 3M's PAPR, or powered air purifying respirators for healthcare workers. Many, many more manufacturers all doing the same thing. Another thing we are doing to help this shortage is the government, are also buying ventilators and other PPE from other countries like China, who have already gone back to normal life, or as normal as it possibly could after this virus. They also are recommending, and they as in the CDC and WHO, are recommending that people who are at home if they have cloth masks, to use those because they are reusable. You can throw them in the wash after you use them and reuse them until you can't use them anymore. They are also suggesting that with rubber gloves or even gardening gloves, you could clean those off, again, throw them in the wash or disinfect them or bleach them, and then you can continue to reuse them. That'll also help prevent the shortage in PPE usage. Moving on to spillover. Spillover event could also be known as a spillover infection or a pathogen spillover, but most commonly known as the spillover event. This occurs when a reservoir population with a high pathogen prevalence comes into contact with a novel host population. The pathogen is then transmitted from the reservoir population and may or may not be transmitted within the host population. So, spillover are zoonoses, and I'm going to be talking about 3 specific and different spillover events that have happened and are relevant to this current pandemic of the coronavirus. These next examples will be from the book by David Quammen in the book Spillover. The first spillover I'll be talking about is MERS, the Middle East Respiratory Syndrome. It is a viral respiratory illness that is new to humans, and it was first reported in Saudi Arabia in 2012 and has since spread to several other countries, including the United States. Most people infected with MERS-CoV developed severe respiratory illness, including fever, cough, shortness of breath, and many of the patients who were diagnosed had died. MERS occurred in Jordan in April 2012, and so far all cases of MERS have been linked through travel to or residence in countries and near the Arabian Peninsula. The largest known outbreak of MERS outside the Arabian Peninsula occurred in the Republic of Korea in 2015. The outbreak was associated with the travel returning from the Arabian Peninsula. MERS-CoV has spread from ill people to others through close contact, such as caring for or living with an infected person. And MERS can affect anyone, and most patients have ranged from the age from younger than 1 to 99 years old. The next example was the previously talked about SARS. SARS caused the outbreak in 2002 to 2004, and in the late 2017, Chinese scientists traced the virus through the intermediary of civets to cave-dwelling horseshoe bats. Lastly, we'll be talking about the Ebola virus. It is a viral hemorrhagic fever of humans and other primates caused by the Ebola virus. And the symptoms are vomiting, diarrhea, rash, and the disease has a high risk of death, killing 25 to 90% of those infected, with an average about 50%. And this is often due to low blood pressure and fluid loss. The largest outbreak to date was in the epidemic in the west of Africa, which occurred from December 2013 to January 2013, with 28,646 cases and 11,323 deaths. So, how are these relevant to today's pandemic? Well, these are all relevant to today's pandemic because each and every one of these have a similarity to COVID-19, and also the fact that with each pandemic we find a new virus, which can be unfortunate. Well, it is unfortunate, but it also can help in not only helping us prepare for the next pandemic, but also allowing more medical advances. And this would actually help in my professional life because I want to be a PA, and this will help me and help me be prepared for if this were to happen again in my career. And lastly, with each pandemic, we find out something new, and then we're better for the next one, and we're more prepared. As of today, there are 3,308,772 positive cases of coronavirus in the world, with 234,133 deaths, 1,042,993 recovered. Today, the total cases in the United States are 1,031,659, with 60,057 deaths. 155,737 have recovered. Thank you for listening, and please stay home, stay healthy. We will all be together soon. We'll be stronger together.